all of you. I'm Irina Bond and I'm the founder of Medi-Gyn Center. Medi-Gyn Center, it's a hormone balancing center incorporating functional medicine, regenerative medicine into our protocols so that we can treat the root cause of any of your hormone-related conditions. Today, we have a very interesting, a very juicy topic that we are talking to Dr. Nahla about. And this topic is sexual health and what is happening with women and men on this occasion while our hormones are decreasing, because it does make a difference, right?
Yes, it does make a difference. Hi, everyone. This is Dr. Nahla Al-Awadi. Originally, I'm a gynecologist and a hormonal therapist, but I'm also a sex therapist. So it's very interesting to combine both the knowledge of gynae and the knowledge of hormones and the sex, because not everyone talks about sex on the aspect of what's our body role inside our physiology to do with it.
Yes. So sexual life, of course, it's very important. It's important for younger generation of women and men, as well as for more mature. And I do believe that we could have successful sexual life even later in life.
Even later in life is more important because, when you grow up, you seek intimacy.
Absolutely.
And whenever you are older, you have less job to do, you have less work, you have less friends and family attachment. Your kids are growing and everyone has his own family.
Yes.
So your partner is your
stability,
yes,
your
stability and
support.
Yes. So I think sex for elder people is very essential.
Absolutely.
Unlike that we are saying that they are getting old and they don't want it anymore.
Yes, exactly. But I think to feel alive,
Yes.
sexual life is
It
very
doesn't have
important.
an age.
Yes, it doesn't have an age. And that's what we are going to talk about. So, thinking about sexual life, we straight away think about libido. But do you know that libido from Greek language
Yes,
is actually zest for life?
Yes, because see, even us in our English, we're saying libido is the desire to have sex. So this means the desire of sex is the desire of life, and this is what the Greek they thought about it, and they have lots of rituals about this. But nowadays, everyone is stressed. Everyone is having lots to do in his life, and he's forgetting it or he's doing it in a wrong way.
So in our conversation today, I would like to highlight also a little bit of younger generation issues for this topic, for the topic of sexual life. So how is it affected? How is sexual life affected during our younger age?
Well, first in women, of
Yes.
course, the younger age, they have not enough experience for that. So her configuration between her body image and her ability to do this will affect her sexual life.
Mhm.
And the most important thing, her hormonal imbalance, and it's a physiological thing. All her menstrual cycle, there is a balance between estrogen and progesterone, and sometimes it decreases, sometimes it increases during the 28 days of the cycle. So she might have a strong desire today, but next week she will not have the same desire. So for her, because she doesn't have enough experience, she will feel like something wrong with her, while this is her physiology. She will not have the same desire all the months, I mean. This is the most important thing for women, and her relation to the topic of sexual life itself, because she might have some emotional things, involvement about her partner, some concern in her family, or the way she's grown up. So this all, and she's not grown up enough to have her own experience, to develop
Yes.
her own personality in that. And for me, women are recipient. They receive the emotions, they receive the experience of the physical intimacy, and then they express it later. So this is the most important stage of her life, to receive it in the right way. So she will be well educated and well aware of what to get and what not to get, and doesn't fit her again.
Yes, yes, yes. Of course, traditions, cultural awareness, and so on and
Yes.
so forth. It makes a huge difference.
Yes, and
Bit,
this is in a young generation, 20s to 30s, where all hormonals takes place. All
mhm.
hormones, all our hormones are like bursting away and changing, and she might have one baby, so there will be a hormonal changes. She will
Yes.
encounter lots of first-time diseases like a polycystic ovarian syndromes, and this is what happens. So lots of hormonal changes, and it will affect, of course, her sexual life.
Yes. So, what about a very kind of controversial topic a lot of the times, contraceptive pills?
Yeah.
How do they affect our moods for sexual activity, our sexual life overall?
Okay, let me just begin. Like, I'm a gynecologist. I'm still prescribing, and I'm not saying I'm prescribing. I'm still. And maybe I will go after this episode to my clinic, and I will still prescribe it. Contraceptive pills are very good and safe methods for lots of women working, having family, and it's for lots of women are more convenient for them. But what's happening really in
At a
contraceptive?
biological level.
Yeah, in biological level, the level of estrogen and progesterone that we are using, and sometimes it's not a progesterone, it's a progestin, which is synthetic, will affect a lot her libido. It might cause her no libido at all. Up to that, as much as it cause her a little bit episodes of depression or make her mood swings, and it's written in the literature, so of course it will affect her libido a lot, a lot. And this doesn't mean that we will stop prescribing it, but it means that we will have to be aware, and we have, if I'm gonna prescribe it to my patient, I have to know if she encounter this, what I shall do with her. Stop it or continue or give something else. Because if you do that, you have to know what's to undo it. And this is the problem. We never ask the patients about this. We always ask them about the weight gain, the hair, the other side effect of the
Yes.
contraceptive pills, but we never care about this. And we thought that, or she thinks that she's having this because this is her life, not
Yes,
because
absolutely.
she's using contraception.
Yes.
And if you allow me to say, she's using contraception so she can have a safe sex. So if she's not having it with the desire, why she's using it?
Yes, absolutely. Well, contraceptive pills have its role, of course, and it's revolutionized women's kind of life,
Of
the life
course.
of a woman, basically, and our freedom. It gave us our freedom, right?
I'm not gonna say it as a freedom, but give her more time to do stuff, because it's called the family planning. So it's nothing wrong with planning your family.
Yes,
As
absolutely.
if you're planning everything, your business and your home. You're planning your family. You
Yes.
just not need to get children, lots of children, and you don't know what to do with them.
Yes, absolutely. At the same time, it does affect us at a biological level, and I think every woman should be aware whether to go for a contraceptive pill or not.
Especially, and that there is another kind of contraception. It's called progesterone only. Progesterone only, and it doesn't have estrogen in it, and it's very famous. And we're doing as sometimes as implant. It stays for 3 years under the skin, and this will kill the libido. You're giving only progesterone. It will oppose your normal estrogen, and it will enhance your progesterone level. And progesterone in
will
women
drive it down.
Will drive your libido
Sexual, yeah,
down.
desire.
So it's more dangerous in these areas.
Yes. So ladies, whoever would like to have sexual desire up rather than down, then that level of progesterone may not be for you, actually.
Yes.
So, well, that's great. For all the generation of women, let's say 35 plus, we see a lot in our practices. We see women are coming with IUD.
Yes.
What are the consequences of IUD having for a long period of time in our bodies for our sexual desires, for our sexual activities?
Actually, IUDs also, sometimes of IUD are hormonal, And when they introduce it to the market, they say there is no systemic absorption, but now we know that there are some systemic absorption. So of course it will increase the level of progesterone, and this is a crime that we say to the woman, no, your progesterone level will not be affected by your IUD, but it will be affected. And the other type, which is the metal IUD, it will only cause like some sort of pelvic congestion. It might increase the dyspareunia she will have, which is pain during sexual intercourse. This will make it having more effort in doing it in her sexual life. And if you're not enjoying it, eventually you will be losing the desire in it.
Yes. In the meantime, it's also causing chaos in your hormones, right?
Yes.
Am I right?
Any hormonal, even the hormonal IUD, it will affect your
natural
body. Yes. And the problem is, for a long time, we're talking about in our conventional medicine that side effects are not really what we are. How can I express it? That we are not looking at the side effect until it causes a real disease, a developed disease.
Condition,
but yes, a developed medical condition. Like it will cause a tumor, it will cause like hypertension, stuff like that. But we are not nowadays we are looking it into another perspective, the functional, that I am having a job. I wake up in the morning, I go for the gym. In the night, I don't sleep well. So if this drug I'm taking, or the IUD I'm using, will stop me from doing my normal life activity.
Yes.
This is another side effect that we need to take care of.
Yes. Absolutely. So very interesting. And then of course we are coming into all the generation of ladies. I'm one of them. And with the decline of estrogen, we are facing all sorts of changes in our bodies, going into perimenopause, menopause. What is happening actually at this stage with our sexual desires?
This stage, Irene, I know that you talked a lot about it, and you're like a role model for most of the women. And I'm sure most of the women are envying you, like we want to be like her. Okay, so in this stage, the decline in our estrogen, and this is a physiological, this is how we are reaching our golden age, will cause you dryness in your vagina. It will cause lots of libido decrease in your even in your centers. Okay, and we have to take care that the neurotransmitters, the dopamine and the serotonin, are also involved, and it's affected by our testosterone and estrogen.
Absolutely.
So it's all declined in this golden age. So women should take a BHRT, of course.
Yes.
Like if we're gonna say no, there is no hot flashes, no, she's good, she doesn't have the genitourinary syndrome, she's not, no, loss of libido is part of the genitourinary
no need
syndrome.
For hormone therapy.
It's part. It's in literature. It's a part. Loss of sexual desire in menopausal women is a part of the genitourinary syndrome.
Absolutely.
So it's something that we need to ask our patient about. And even for men, now we're talking about andropause for men.
Yes.
The decline in testosterone. You know, like after the age of 50, men are having lots of problem in their sexual desire, and their testosterone up to age of 70, 50%. This is in literature. 50% of men will have an erectile dysfunction.
Absolutely.
Even without other disease, like even without other physical disease, that will have it. So of course we have to give hormones, and we have to respect our hormones level, and to live better.
Yes, absolutely. On the topic of men, we nicely kind of came to this topic, which is very important to address. Absolutely. We see in our practice more and more inquiries from our men. Even though Medi-Gyn is primarily focused on women, we see a lot men, because our ladies refer them to us,
Yes.
refer their partners, refer the boyfriends.
And this is a very good thing that their couples
Their
are talking
husband.
together, and
Absolutely.
this is what we like we are having effort to do in
Yes.
the clinic. That
Yes, absolutely. And we see younger generation of men already facing this issue.
Yes.
Not just after 50.
Yes.
After 40, just after 40, men are facing
After
this
35
issue a
even,
lot.
yeah.
With estrogen, I think, being more dominant in their bodies. Is that so?
Yes, some doctors will say it's because it's caused by liver disease, or some, like they need a liver detox and stuff like that.
For detoxification, body
yes,
detoxification.
Yes, and because our liver is the responsible for converting between our testosterone and estrogen. So the levels in men will differ if they have something wrong with the liver. And other stuff that sometimes they take lots in the gym, some testosterone and stuff like that. But the most important thing, the stressful life they are living, the unhealthy lifestyle, like going out till late, and he has to wake up early in the morning, he's not concentrating, his level of energy is decreasing.
Yes. Yeah.
And this is also one of the symptoms of the low level of testosterone, because testosterone is an energy hormone. So when you're not energetic enough in the morning, man or a woman, this means your level of testosterone is getting low. If your sexual desire, man or a woman, are not satisfying you, or it's decreasing, you feel like I don't have it and I don't need to do it, my partner want me but I don't want him, not because of him, because of me, I'm not into the sex. This means you have a low level of testosterone, man or a woman. If you're not having these fantasies, you're not having it because it's sometimes it's healthy, not having too much of course, but it's healthy to get it, like the desire of food. Sometimes you're not hungry but you're craving for something. If you don't have it in your sexual life like that, this means a low level of testosterone. So it's not only a blood test, and it's a very easy applicable hormone, especially that now we're taking it as a bioidentical hormone.
Yes, absolutely. So it's pretty easy, it's pretty safe. It's very safe, I would say.
Yes.
It does not cause any side effects.
No.
So whether woman or man.
And the advantages are amazing.
And the advantages are incredible. Yes. So bioidentical hormone therapy, of course, it's one of the ways that we can increase your natural.
It is the way.
It is the way, yes, exactly. What else can we do to enhance our sexual life, let's say, for a woman and a man?
For a woman, especially woman, she needs to understand herself first, because women are very emotional persons, especially when it comes into sex. And for lots of decades, we thought that we're one of the myths that we are treated, or we are learned, that men are the one who's have to ask you for this, and he is the dominant part. Of course, he has some dominancy, but sex is a game played by two. So women should understand her part, so understand her body, understand her part, understand her hormone, what she's doing and what she's not. Is she taking a contraceptive pills or not? Is she having an IUD, or in which day of her menstrual cycle now she's in?
Yes.
So all these questions she needs, she need to know her answers for. And she need to seek an advice whenever it's possible, when she finds something, when she's worried and or she concerned. And of course she had to like everything, her hormones should be monitored and focused in. So some procedures in our clinic as a gynecologist and aesthetic gynecology we're doing, like the O-shot and G-spot amplification with PRP and exosomes. Of course, it helps a lot in orgasm and libido for women, especially for postmenopausal, because also it will increase her lubrication, and make a new collagen synthesis. And some other vitamins and antioxidants like the ginkgo biloba, it's all natural, and L-arginine. So those stuff might help with our hormonal therapy.
Are these vitamins in form of injection or it's a form of tablets,
Well,
capsules?
I like it more in sachets and capsule form, and it's a natural things. So it's and L-arginine is a very potent vasodilator for both women and men, and so it will increase the blood flow to the pelvis, and it causes something called the nitric oxide, which is, you know, the Viagra is always working
one of the
in the,
elements.
yeah,
of-
is working on this nitric oxide that increase the nitric oxide. So arginine increase it, but in a, of course, in a lower level, and it's a vitamin antioxidant afterwards,
yes, yes.
amino acid. So if we give it to men and women, in men we improve the erection and libido, and in women also we improve her sexual desire. But this is just a vitamin, and you need to understand that if your hormones are not working, nothing will work.
Yes.
Even the very expensive stem cells and exosomes I'm using, no, it will not work without adjusting your estrogen, especially estrogen.
Yes, absolutely. Well, hormones can break, either make your sexual life or break it, right?
Yes.
So,
And
ladies,
nowadays,
what do we
yeah.
do to understand where we are with our hormones, Dr. Nahla?
First of all, understand your body, and whenever you feel like something wrong with you, just go to your gynecologist for a hormonal coach. For someone like Irene, you talk to her, and she will give you a questionnaire, because it's before like you're doing lab tests. You have to understand. Maybe I have a good level of estrogen in lab if you read my
Yes.
lab, but functionally, no, I need more estrogen.
Absolutely.
Who will understand this? Some questions you need to ask me, and I will answer this question. Then you will understand, oh, you need something. Let's do your lab test. Let's see. Let's adjust it.
Yes.
And
absolutely.
for my twin sister, she will not have this concern, and maybe lesser estrogen than me, and you will tell her, no, you're good. Just no, you're good. You're still good.
Yes, absolutely. The fact that we've talked about it before, right? Within a range.
Yes.
That range may not be right for you or for me or for anybody else. That range may be right for your neighbor, your sister.
Yes.
So everybody has their own range.
And it's a big range. If you read
And it's a
any
big
lab,
range.
you will find it a big range. So how can we say it's an optimum? It's my body, my concerns.
How you feel.
Yes. So I think the questionnaires are most important. The questionnaires is not like just questions to collect information. It's to give you time to think, to give the patient time to think how to answer them. Then when I read it and I discuss it with the patient, we will figure out a better than just an interview that I'm talking to her in the clinic and I'm busy, she's not in her mind everything, you know.
Yes,
this
absolutely.
is what I love about hormonal questionnaires for both men and women, and it break the ice.
Yes, absolutely.
In the first meeting, it break the ice.
So what are the sexual life, or let's say, of course, hormone disruptors, as we know, it could cause chaos in our body due to hormonal issues. But then what are other sexual life disruptors in our life?
Sexual life disruptor is the first thing, and am I allowed to say it? Pornography. For me, it's like making a taboo for you. Like you have to do it like that. You have you have to dress like that. You have to have this position. So either the pornography or the meth that we are always having in our mind. So we need to have sex education, all of us. From the beginning, we need to stop these pornography things, even soft or hard, because it gives us false ideas.
Yes.
And the second thing, the stress. We are all stressed. We need
that's
to relax.
That's what I was thinking about, but Dr. Nahla.
No, because
but
see,
that's a good point.
Those ideas are giving you stress, because you're always saying, am I doing right or I'm doing wrong? Am I good in this or not? So you'll be more stressed. But the stress in life, we are all running for jobs, running for money, running for
Tell
children.
me about it.
Yes. So we need to relax, to do meditation, and you're very good in this, and you need to make a podcast with you about our meditation.
We will talk about it for sure.
Yes, and healthy food, of course, because having a good food and the relation between your gut and brain barriers will, of course, will enhance a lot in everything. Because our body is a holistic, it's a whole unit. So we cannot talk about it without talking about, and of course the hormones, and I will say it again and again and again. I cannot treat a woman with a hormonal imbalance. I saw it a lot in my clinic, and all the gynecology, maybe after this podcast they will review all their cases. Of course the hormones will affect her. Even hormones that are not, we are calling, the estrogen and progesterone and testosterone, we're calling them sex hormone. But what about the hormones that we are not calling them, like the thyroid, the adrenal? Are they affecting? Of course they are affecting. So if you can, because our sympathetic and parasympathetic system are the one controlling, especially for men, controlling his erection and ejaculation. So if they are affected, of course he will have lots of disasters, and no one will care about it, because he has another disease. He has like a thyroid, hypothyroidism, or hyper. He has another medical condition. So,
but you see, what we see in our ladies, the minute, especially perimenopausal, menopausal, postmenopausal, especially perimenopausal, at the beginning of their kind of this stage of their lives, the minute you alleviate those symptoms and you increase the level of estradiol in her body, progesterone, and so on and so forth, it's kind of slowly but surely all the symptoms disappear, and then slowly but surely the sexual desire appears as well, right?
Yes.
So the same, I believe, with men. The minute you increase the testosterone level, potentially you could also affect your thyroid or any other organs in your body.
Yes, because he will, of course, because whenever you adjust one hormone, the other eventually will be better, because
will follow suit.
Yes, because they are all having a cycle, especially the cortisol, progesterone, and our other sex hormone.
Our sexual desire, just the last question, because of course time is running out. Our sexual desire, we say that it starts in our heads. So how would neurotransmitters affect our sexual desire in this way?
Actually, dopamine is a motivation hormone. It will affect a lot. It will make you want a lot of in your life, especially in your sexual life. Serotonin is a little bit less than this. It might inhibit it a little bit, but the balance between them will eventually cause a better desire. Okay, but it always began with the dopamine, and anything that decreases the serotonin in the level of dopamine, like in the favor of dopamine, will increase your sexual desire. And sometimes it's not good, because it will cause a sex addiction or something, and sometimes it's good, because we are not having enough desire. And they are both controlled by other hormones. Okay,
of course.
Yes. So and most of them are our sex hormones, meaning most of our, and prolactin, of course. And so the neurotransmitters are very important topic. The cortisol, the stress hormone, it affects the neurotransmitter. The adrenal, our adrenal gland, it affects them. So of course, this is why our sexual life is a hormonal imbalance, either with the sex hormones or the other hormones.
Yes, affected by our sexual hormones.
Especially with the neurotransmitter. And in men, sympathetic and parasympathetic systems are the one involved in all the level of men, from erection to ejaculation and excitation as well. So of course the neurotransmitter are the initiator for that, and it's controlled by his testosterone.
Very interesting topic. We could talk for hours, but it's time to finalize it. So Thank you so much for joining us. Thank you for watching this podcast. And Dr. Nahla, thank you for
Thank you,
joining us
Irene.
too.
Thank you for giving all of us a chance to talk about hormones in all our different aspect of life.
Yes.
Not also as a hormones, as we always teach people. Hormones are hormones. No, hormones are our body.
Hormones are running our lives, and it's time that we all understood that, and it's time that we take actions and check regularly. So welcome to Medi-Gyn, anytime, anywhere, at any age. Thank you so much again.